My name is Patrick Buckley. I'm a sports medicine surgeon at University Orthopaedic Associates. The ACL, or the anterior cruciate ligament, is one of the four main ligaments of your knee. And the main job of the ACL is to prevent an abnormal motion of your shin bone in relation to your thigh bone. So an ACL injury can happen in really one of two ways. It can be from a contact injury, where your leg is impacted or you have a fall, or more commonly from a non-contact injury. That's often where patients are playing a sport, they go to plant, pivot, or change directions, and they feel a pop in their knee. That's a very common way for a patient to present who has an ACL tear, and that's something that I really listen for as I'm evaluating the history of that patient. When I see a patient in the office and after I listen to their history, the next step is to perform a thorough physical exam. And that's really the way that I can try to identify if there is an ACL tear and if there is abnormal motion or laxity of the knee when I check the ACL. When I suspect a patient has an ACL tear, my next step is to obtain imaging. And the first step of that imaging is x-rays, which I can obtain in the office. And it really helps me to evaluate if there's any sort of fractures or broken bones of the knee. Frankly, most of the time it's negative, but for younger patients it's very important to evaluate the growth plates and whether or not they're open and present, because that affects what the treatment plan is for an ACL tear. After that, my next step is to obtain an MRI, and the MRI allows me to look at the ACL to see if there is a tear and also to see if there's a bone bruise pattern of the knee that signifies that there was an ACL tear. The treatment options for a patient with an ACL tear really start with beginning some physical therapy to work on getting your motion back of your knee and helping the swelling to go down. And for most patients who have an ACL tear and those who want to get back to pivoting, cutting type activities, an ACL reconstruction is what I would recommend, and the goal of that is to help prevent future meniscus and cartilage damage in your knee. When I'm talking about treatment options for a patient who has an ACL tear, it's also important to look and to consider all of the other structures in their knee. So looking at their meniscus, their cartilage, as well as the other ligaments in their knee, and picking up injuries on those structures are very important to help limit that patient's re-tear risk of their ACL as they return to play once they get back to full activity. So the timeline for return to play after an ACL surgery is something that really begins with physical therapy, and that starts the first day after surgery. The goal is to regain your motion and help get the swelling down in your knee. After that, we're building strength. Most patients return to running around 4 months, and for most patients who want to get back to a pivoting, planting, or cutting type sport, I recommend that we do that around 8 to 9 months from surgery. Often I'll work with the physical therapist that they're seeing to try to do different exercises and tests in the physical therapy gym to determine if there's any deficiencies that we need to optimize to help lower their re-tear rate and allow them to return to play.